Hi, welcome to the Worldwide Medicine channels. Today we'll be talking about schizophrenia. So, what's schizophrenia? It is a psychiatric disorder characterized by constellations of abnormalities in thinking, emotion, and behavior. Symptoms of schizophrenia are broken up into three categories. These include positive symptoms, negative symptoms, and the cognitive symptoms. The positive symptoms include hallucinations, delusions, bizarre behavior, disorganized speech, and they are more respond to first generations of antipsychotic medications, whereas the negative symptoms, they respond to the second generations of the antipsychotic medications. And to remember the negative symptoms, we have the 5 A's and include anhedonia, which means lose of interest in doing activity. The affect will be flat, alogia, apathy, and poor attention. The cognitive symptoms, there is an impairment in attention, executive function, and working memory. These symptoms may lead to poor work and school performance. So symptoms of schizophrenia often present on 3 phases. We have the prodromal, psychotic, and residual. The prodromal, there is a decline in functioning that precedes the first psychotic episode. The psychotic, we have the perceptual disturbance, either having illusions or hallucinations, delusions, and disordered thought process content. Residual occur in the following an episode of active psychosis. It's marked by mild hallucinations or delusions, social withdrawal, and negative symptoms. So for the epidemiology, schizophrenia affects approximately from 0.3 to 0.7% of people over their lifetime. Men and women are equally affected, but have different presentations and outcomes. So men tend to present in early to mid-20s, women present in late 20s, men tend to have more negative symptoms and poorer outcome compared to women. Schizophrenia rarely present before age of 15 or after age of 55. There is a strong genetic predispositions, so 50% concordance rate among monozygotic twins, 40% risk of inheritance if both parents have schizophrenia, 12% risk if one first-degree relative is affected. So the pathophysiologies of schizophrenia, we have the dopamine hypothesis. So the exact cause of schizophrenia is unknown. It appears to be part related to increased dopamine activity in certain neuronal tract. So the evidence to support this hypothesis is that most antipsychotic successful in treating schizophrenia are dopamine receptor antagonists. In addition, cocaine and amphetamine increase dopamine activity and can cause schizophrenia-like symptoms. So the theorized dopamine pathway affected in schizophrenia, we have the prefrontal cortical and the mesolimbic. The prefrontal cortical is an inadequate dopaminergic activity responsible for the negative symptoms, whereas the mesolimbic, there is an excessive dopaminergic activity responsible for the positive symptoms. So to diagnose schizophrenia, we have the DSM criteria. So 2 or more of the following must be present for at least 6 months. So, first we have the delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and finally the negative symptoms. So, at least one must be either number 1, 2, or 3. For the prognostic factor, we have factors associated with better prognosis include having a later onset, good social support, positive symptoms, mood symptoms, acute onset, female gender, few relapses, and good pro-morbid functioning, whereas the factors associated with worse prognosis include early onset, poor social support, negative symptoms, family history, gradual onset, and male gender.